Hi everyone, today I'd like to talk a bit about uric acid and heart disease. Why uric acid? I'm sure most of you are familiar. Uric acid causes gout. But do you also know that uric acid is very high or elevated in patients with hypertension and coronary disease? So there have been a number of studies which have shown that people who are at high cardiovascular risk have also very high uric acid. In fact, there have been a number of studies previously which have shown that if you reduce uric acid, by reducing inflammation, you actually reduce your cardiovascular risk. And colchicine has been shown in a number of studies over the past few years to confer mortality or cardiovascular benefit in patients after a heart attack or patients with stable angina. In fact, colchicine was the first anti-inflammatory agent to be incorporated into guidelines last year for the treatment of coronary artery disease. However, more recently, there's been some conflicting data where a much larger study just published have shown no benefit at all with colchicine in heart disease. In summary, I think the jury is still out on whether colchicine should be used routinely in all my heart patients, but I do think it may have a role as an adjunctive therapy on top of standard treatment for selected heart patients who have very high inflammatory markers.